Hello, everyone, and welcome to this session. Thank you so much for joining this very wonderful and very important workshop on crisis management and addressing operational needs for COVID-19. Termed "Stay Strong, Stay Standing," and the reason why I'm excited about this is the focus for youth-led and community-based organizations. So thank you so much. So the title of this session is Safety First, Operations, a Close Second, how to continue your organization's operations in terms of programming and activities. And my name is Onward Chironda. I'm the youth focal point for FP2020, and I'm the founder and director of an organization that is called My Age Zimbabwe, that works with young people in terms of their health, rights, and well-being in Zimbabwe. And thank you once again for joining these sessions. I'll just, I think, as you can see on your screens, there are names of the speakers that we are going to have. We have Stacy, who works for IRC as a senior technical advisor for emergency and health. We have also Ugo, who works for JHPA Go Nigeria, and she is the deputy country director. We also have Martha, who is the executive director of Pro Familia in Colombia, and we also have Rebecca, who is the executive, who works for Save the Children as an SRIH clinical manager. So thank you so much for joining. I'm also just handing over to Samantha, who is going to explain to us how this is going to work in terms of the channels that we are going to be using, and also she is going to tell us more about what the series is all about, and opportunities that may be there beyond this series. Over to you, Samantha.
Thank you. Onward. Can you hear me all right? Great.
Yes.
Heads. Great, thanks, Onward. So welcome everybody, and thank you for joining today. I'm just going to review a few logistical notes before the webinar. So first, you should see a Q&A box as well as a chat box where you can submit any questions you have throughout the session. If you do experience technical difficulties, please use the chat box where you can send questions to the attendees or to the meeting hosts. Now, today's webinar is a Q&A session, which will be in English, but there is a simultaneous interpretation into French. So I'm going to share the instructions for hearing the French translation, both in English and then in French. So before we start, if you want to listen in French, you should select a language option. If you look at the bottom of the Zoom screen, you should see a globe icon that says interpretation and select French. If you're choosing French, you can click on mute original audio if you don't want to hear the English narration in the background. If you're on a mobile device, in the meeting controls, you'll tap the three dots, then tap language interpretation. I'm just going to go over that very briefly in French. So, le webinaire, c'est en anglais, mais il y aura une interprétation en français. Avant de commencer le webinaire, chacun doit choisir une option linguistique. Regardez en bas de votre écran Zoom et trouvez l'icône du globe terrestre qui indique interprétation. Sélectionnez votre langue préférée, l'anglais ou le français. Si vous choisissez la langue française, vous pouvez couper le son original si vous ne voulez pas entendre la narration en anglais. Si vous êtes sur un appareil mobile, appuyez sur les trois points, ensuite appuyez sur l'interprétation linguistique. Si vous avez des questions à ce sujet, n'hésitez pas à poser les questions dans la boîte de discussion. And finally, this webinar is being recorded both in French and English. I'm actually going to pass it over to Katie Meyer at the Interagency Working Group to discuss a little bit more about this series. Katie, over to you.
Thanks, Samantha, and thanks Onward for welcoming everyone. We are so excited to have you with us today. This session, as Onward discussed, is the second of our series. Last week we talked about staff safety, and this week we are talking about how to adjust your programming in light of COVID. And so this series is hosted by FP2020 and IAWG, or the Interagency Working Group for Reproductive Health in Crisis. IAWG, for those unfamiliar with it, it is a broad-based, highly collaborative coalition of more than 20 steering committee members. We have members from the UN, government, NGOs, research, and donor organizations, to name a few. While we have 20 steering committee members, we have over 2,100 individual members that range from all different types of agencies, representing around 450 organizations, all with the same goal of advancing sexual and reproductive health of people affected by crisis. So the reason that FP2020 and IAWG came together for this series is directly in response to what we were hearing from young people and youth-led organizations, that they need some operational guidance and they need some advice during COVID. So we organized this session, and we were so grateful to have speakers from all over the world and from so many different agencies. So we'll kick it off to Onward, but I just want to put in a plug that we also have some funding attached to this series, which we will talk about at the end of the session. Thank you. Over to you, Onward.
All right, thank you very much. And you know, your close off about funding is very, very interesting, especially for young people and for youth-led organizations. So as we are just going to start, you know, as a young person and as someone who is leading a youth-led organization, which is also community-based, the pandemic and, you know, the environment that was created by the pandemic has actually affected a lot of good work that community-based organizations have been doing, and that youth-led organizations has been doing. And this comes at a time where, you know, there is already shrinking space. This comes at a time where also youth organizations do not have adequate funding. Community-based organizations do not also have adequate funding for various good work that they are going. This also comes at a time where, you know, there are questions about the capacity of youth-led organizations, the capacity of community-based organizations to receive funding from donor agencies. So, you know, then COVID-19 comes, the operational environment changes, and now you need to shift the way you are doing your activities and your work. And, you know, it has been quite a very, very high time in terms of adaptation. For me, with my organization, then it's, you know, engaging with donors, trying to shift the way you are doing things. You probably have some knowledge of what works, and probably the donors don't agree if that will work as well to bring the same results. You probably need to maybe extend budgets so that you can maybe group people into small groups, and, you know, so all those things. But I'm sure that we're going to be, you know, sharing more as we are going on. So for us, you know, young people, communities, recommendations to start using Zoom. And, you know, with young people, they don't even have the gadgets, they don't even have connectivity. It works for some environments, but, you know, doesn't really work for some environments. But anyway, so I know that we have people that are joined from community-based organizations, and we have young people that have joined also who are working with youth-led organizations, or who are leading work on sexual and reproductive health in this environment. So I want to submit to it that, you know, the same challenges that you guys are having are the same challenges that we are having, and we have tried to, bring expertise, and we also want to hear from everyone. So feel free to drop your comments as we go and your questions in the chat box as well, because we know that you are facing similar difficulties, and we are both here to learn and share experiences from each other. What's important and what we want to come up with is, if we can able to continue access to sexual and reproductive health information and services in this environment in our different communities. So I'll pose a question, and I want to start with Ugo. Why do you think that sexual and reproductive health services are critical to continue in this environment, and what do you think we need to do to make sure that we prioritize these services during this pandemic?
Okay, thank you very much, Onward, for your question and also your introduction. And I welcome everybody that has actually joined this webinar, both my fellow panelists and the audience as well. So that's a very critical question. And I believe that it is very crucial that we really balance, the COVID pandemic response with coordinated actions to actually maintain these sexual and reproductive health rights services, because of the impact that we have seen that it has had on the different sections of our community. I will recall during the lockdown in my country, and I believe a lot of other countries, that there was just this general confusion about what services were open, which ones were closed, which ones were rescheduled. And then also the fear and anxiety of even people going to the services, because they were fearing, that they might get the COVID-19 infection. And then above all, the spread of the myths and misinformation that actually happened during that period, that's still happening. So of course, this led to a significant decrease in presentation of clients to these essential services that we are talking about, such as family planning services, contraceptive services, counseling and information services, including even medical supplies. So I know that period, we had a number of studies, even some studies are still going on, and assessments that actually assessed the indirect effects of the COVID pandemic on these services. And they did this in a number of low, medium income countries. And I'll just read out a few things that they actually found. They estimated that an additional 49 million women and girls had unmet need for modern contraceptives, about 15 million unintended pregnancies. And these pregnancies, some of them were teenage pregnancies as well. And some of them actually led to unsafe abortion care as we were going on. And then, of course, estimated additional 28,000 maternal deaths and 168,000 newborn deaths. And a conservative estimate of 10% decrease in access to care for reproductive health and family planning and all that. Additional observations during this period, and even still ongoing, was the exacerbation of gender-based violence, and even lack of, people had mental health issues and couldn't access services. The GBV were usually due to or fueled by, people that were, lost their jobs, the stress, even the restricted movement during that lockdown period. Some people have actually even, predicted that there will be poor educational outcomes for young people because they've stayed for very long at home, actually. So you can see the impact, this period had on the population of young people, girls and women. So in this, in view of this, I think it is important. This actually gives you the whole rationale that we should not lose the hard-earned health gains that we've made over the years. And we need to really strike the balance between, managing the pandemic is very important, but we have to strike that balance of, at the same time, trying to prioritize these sexual and reproductive health rights services so that young people and adolescents can actually, be able to access these services, and we can prevent some of these impacts that I've actually outlined. I'm sure as we go on, we will be more specific about what services that we can actually provide during this period. Thank you, Onward.
Thank you very much, Ugo, for quite, a comprehensive submissions. I know that you have so much to say. That's why you mentioned that you could say more. But you talk you emphasize very important points around prioritization, and you also emphasize very important points around losing the gains of, where, advocacy had been, the gains where service provision has been, the gains in which, information, had been shared. And most of the time, because of the shrinking space in terms of even funding, youth-led organizations and community-based organizations have a lot of actually gains to also lose. And what I've also noticed, even with my organizations, is now when you want to go to the local government and you say, this is what we want to do, and this is the work that we have been doing, we want to continue in this environment, the focus has shifted with even health service providers. Some are just saying, you know what, we focus on COVID-19, even if they don't. Some are in fear of, if clients come, then maybe there are infections. But as well, there is something that is going on where when you engage the local government, you need to kind of donate some PPE, or you need to show to it that you are not just focusing on sexual and reproductive health. They won't take you serious if you don't actually contribute to protective equipment. And that has been a challenge for many organizations, because that the door can be closed simply because you do not have a budget for that. So I want to move to Martha. I don't know if I pronounced that right, but I think I'm okay. What is the balancing act when we look at, focusing on providing sexual and reproductive health services while understanding the operating environment that you are working in, and including also priorities from the partners that you're actually working with?
Thank you so much, Onward, and thank you everybody for the interest in learning about how we have dealt with everything that has happened. And I like what you said at the beginning regarding the fact that independently of how big or small we are all facing the same uncertainties and confusion and overwhelmed conditions. And in that sense, for us, that act of balancing was the first huge challenge that we face. In what sense? In the sense that we knew, because of what Ugo mentioned before, we knew that it was absolutely vital for sexual and reproductive services to continue being provided. But at the same time, we have all these instructions and new regulations coming from the government all the time, trying to deal with it, with the pandemic, and then the partners request their needs, but also worries about what was happened. The first thing that we did, we tried in the middle of all the confusion, we tried to be, let's step back and try to be pragmatic as we can. And we create a small committee with people from different areas of the organization and expertise. A very important fact, we gave them all the autonomy and authority in order to make decisions very fast. The message we sent to the rest of the organization and people, especially people in the field, was we are going to follow the guidelines of these small expert groups, so that instead of having a lot of people trying to make a lot of decisions at the same time and facing all the regulations and partners requests, we choose a group of leaders that has helped us along these 6 months already to go through the huge challenges that this has meant. They also, the committee helped us make decisions very fast and implement them very fast. In a couple of weeks, we were able to have all the people from the administrative staff working at home. And we told them, you'll end up receiving the equipment that you need in order to work at home. But in the meantime, please go home so that we will avoid contagious at the clinics. Another thing that happened very fast is that they appointed me with the purpose of keep on advocating at the government and with the local governments in order to make sure that in the regulations that keep coming out, sexual and reproductive services were considered as vital. That was the entry point through which we decided this is one way of guaranteeing that they will continue being important. Also, that we did very fast, we opened a credit line with the bank because we didn't know if we were going to have enough resources to pay for the PPA commodities that were needed at the clinics. And we wanted to, we were fighting very strong since the beginning to keep the clinics open and to be able to continue visiting the communities that we serve. One of the things we have to do very fast, we have to check our digital tools and, like focus on implementing telemedicine and virtual counseling because we knew that a lot of requests were going to be coming that way. We started a very small line because we had some psychologists, a mental health line, because we also realized that there were going to be issues regarding the mental health of the population. A lot of that in accordance with gender-based violence. And then we decided also that the youth network that we had in Profamilia, that we needed to find out very quickly how they were, the risks that they were facing, not only regarding sexual and reproductive rights, but also regarding things like nutrition, access to commodities like food, and the rest of the health needs. So we carry on a donation program inside Profamilia with all the employees. So we would help them. We will help them provide with supermarkets and food, because in a lot of the small places in Colombia, they were for a couple of months unable to have access to things like food. We also have to decrease the face-to-face visits and surgeries in order to protect not only the staff, doctors and nurses, but also the users, of course. And then permanent communication through the digital tools that we have. This is a day-to-day information that is going out to the staff. So we reminding them to please take care of themselves, but also to the users, because not only telling them that the clinics are open, but by useful tips, telling them how to take care of the sexual and reproductive rights and health, but also about the common basic knowledge about COVID.
All right, thank you very much. You raise a lot of very important issues, around understanding the operating environment. Maybe let's go to Stacy and Rebecca. You choose who can maybe start. But my question to you is, how do we know which activities are the most important to carry out during COVID-19? Because, there's a lot of shift in terms of work plans. There's no knowledge on when is this going to end. When it started, we thought maybe it's weeks, maybe it's month, 21 days lockdown, another more 21 days, another more, and level 2, level 3, level 4, back to 1, back to 2. So which activities in terms of prioritization are the most important to carry out?
Thanks, Onward. I'm happy to start, Rebecca, if you like. And a big warm welcome and hello to everyone who's joined the webinar. So I think for this question, when we think about, what activities are most important, I think there's two ways of thinking about it. I think it's important to think about our pre-existing activities and work and what, should continue during COVID. then it's also important to think about what activities are important, particularly from an outbreak response perspective in terms of stopping transmission. So when we think about the first in our pre-existing activities and which are the most important to continue, the answer really is all of them. Everything that we do is important, and it's designed to improve the lives of the people we serve. This is not going to be a short, sharp crisis. And I think Ugo already has, nicely set the scene for what we're worried about here in terms of the big secondary or indirect effects of this pandemic. So we need to be clear on what the goal is. The goal is to safely continue all of our pre-existing services as much as we can. Now, to do this, all of our programs will have inherent risks, which may promote the transmission of COVID. And that could be risky for our staff, and it could also be risky for our clients. So it's really important then that we adapt our programming in order to reduce that risk. So the ideal is that we're able to safely adapt our programming, reducing risk and continuing programs as much as possible. Now, in reality, that's often not possible, and it's not possible either because we don't have enough resources to make the adaptations we need, or if we're working in health facilities, we might need to free up additional resources. And I think at these points, we then have to make some hard decisions and choices about how do we prioritize. I think when making those hard decisions, utilizing a framework to help guide you is probably the easiest way to do it. So, for example, at the IRC, across all of our sectors, we've used the UN program criticality framework for that process. So that's a framework that can be used to classify your programs into life-saving, life-sustaining, life-dignifying, and life-enhancing. Also within SRH, you have the MISP, and I think the MISP is a really useful and important anchor for this process when you have to prioritize. So essentially, if you have the capacity and the resources to safely adapt all of your activities, then you should do that and continue those activities for as long as you can. Where you find that capacity and resources become stretched, it's important then to give priority to continue life-saving activities and temporarily suspend other activities. And just to finish, the other way of looking at this question is then thinking about, what activities are important to help contribute to interrupting transmission and stopping COVID. So thinking again, about things like surveillance, risk communication, community engagement, IPC, case management, etc. And so, the answer here in terms of which of these activities are most important is unhelpfully all of them. Because successfully containing an outbreak requires all of these activities to simultaneously be implemented at scale and to quality. Now, when it comes to making decisions and priorities about where you should contribute to these activities, I would very much advise to center on your experience and capacity and to leverage your pre-existing programs. So if you work with youth associations and community groups, I think you're very well placed to support with risk communication and community engagement. If you work within health facilities, you're very well placed to support with IPC, etc. So I think taking that approach will, enable you to not only move more quickly, but also to move with quality. And that's really important when we think about interrupting transmission. I'll stop there and allow Rebecca to add in.
Yeah, first of all, hello also from my side. And Stacey, thank you so much for setting kind of that scene of kind of introducing a framework. And I fully agree with everything you actually said, but I thought I might just bring in a few more practical examples of what that actually might mean for a like a service. So if your organization is providing a service at community level, for example, then I think one key activity, which was already mentioned, but which is a really important activity for you as an organization, is to address the risk and assess the risk for your staff, for your service users, for your community. And so if you make a decision to continue offering those services, then at the same time, you also really need to think about practical steps on how you can do that as safe as possible in the current pandemic. And that would be things, for example, setting up hand washing stations at your facility, thinking about how you can structurally change your facility, moving maybe waiting areas outside, introducing physical distancing at your site, having ways of monitoring your staff and staff health in particular, ensuring that your staff know what to do if they themselves have symptoms, or maybe a family member has a symptom. So ensuring that your staff has the information at hand to actually make those decisions at service level. And then maybe to add on the point raised around your community engagement. One of your key activity is to understand the need of your community. And in particular, in this pandemic, we have seen that communities have had a lot of concerns around, for example, a health service where staff members were considered additional risk if they came back home into the community, and where that might have been one of the reasons that, for example, communities were reluctant to go to a facility. So if you have a way of engaging your community, of setting up feedback mechanisms, of having those key discussion in a way which aligns to physical distancing. So you meet maybe stakeholders, community stakeholders outside, and you limit like numbers of people who can attend. And then you find a way to collect this important information so that you can adapt your programs, because your program is only as good as it actually meets the need of your community or of your target group. And this is not new. We have done it also in our normal routine essential services, but it's in particularly important in this fast changing environment of the pandemic, where communities are extremely concerned, and where information from the government and from other stakeholders, from partners, is changing constantly. So your organization needs to be there as a as an organization who is allowing those discussions with their community members, with their beneficiaries.
Thank you very much, Stacy and Rebecca. And you guys mentioned very, very important issues. And Stacy talked about the pressure to continue work versus the risk that is posed actually on having to continue with work and activities, and the risk to even spread COVID-19. And Rebecca talks about restructuring, and talks about understanding your community and following also the guidelines. And I'm very happy that Stacey also talked about a very important tool that is called an engagement strategy. And I think she talked about the document. It will be posted on the chat box for those that want to have access to that kind of tool for their work. But when we're talking about restructuring, when we're talking about changing in terms of a strategy, and we're talking about having hand washing machines, we already talking about having PPE in place. Maybe back to you, Stacey. This then has to do with a lot of change in terms of priorities, in terms of change of timelines. How do we communicate these changes and shifts to donors, you know, in terms of the activities that we can no longer even complete, or the, you know, the funding now that we now say, you know, 35% maybe of admin or of activities, we need to, you know, actually put some percentage of our funds into PPE, because we are shifting the way we're doing things. An activity at 100 people, we're supposed to reach 100, but now I have to do 3 meetings of 30 people, or 2 meetings of 50. How do we communicate these changes and shifts to donors? And what do you think are probably the challenges that come with that as well?
Yeah, thanks, Onward. That's a really important question. I think, you know, for all of us, no matter, you know, big organizations, small organizations, I think, you know, COVID has been very unsettling and disruptive for how we do our work, and it's been very challenging for everyone. So I think with donors, you know, firstly, donors will often be flexible when unexpected events occur, and particularly ones that are outside of your control, like COVID. Now, flexibility is going to vary, but this is one of the most important things to understand early, is how flexible is your donor and what kind of flexibility do you have with your donor. You know, I'd always recommend contacting your donor promptly when these sorts of things happen. Inquire about what the donors are thinking, and set up a meeting to kind of talk in detail about your program and what you see as some of the challenges and implications. And prior to this meeting, I think it's helpful to do some internal work, you know, thinking through your project and what you think, you know, the likely shifts and changes are going to be, so that you can take the donor through this when you meet about it. So things to sort of think about your program and your work is to talk about, you know, the impacts of the crisis. You know, do you anticipate delays with certain activities? Do you foresee having to cancel some of your activities? What mitigation measures are going to be needed for your current activities to make them safe and able to continue? This could be things like additional training for your staff, or, as we've mentioned, PPE, hand washing stations, etc. Are there new activities that you now need to do in light of COVID? What resources would you like to redirect to COVID to respond? Do you need to realign your budget, alter your milestones, change your work plan? And I think, you know, essentially be honest about what you see as the implications of COVID on your work, and also be flexible and constantly review, you know, what you think is going to happen in the next 6 months. And what actually happens is quite likely to be 2 different things. I'm also a big believer of, if you don't ask, you don't get. So be clear about what you're asking of your donor. You know, we want to shift our milestones. We want to amend our log frames. We want to realign our budget. We would like a no-cost extension. We would like more money, etc. Obviously, you know, it's important not to move ahead and make changes without approval from your donor. So these conversations are really, really critical. In particular, you know, make sure that you understand what will be allowable costs by your donor. If you're having to suspend activities, some donors may not cover costs, so it's really important to unpick and understand that. It's also really important to keep good documentation of the communication that you're having with your donor, particularly if you're having verbal conversations over the phone or in person. It's really good to capture that in writing, so that you know, and your donor are on the same page with what needs to happen. And then I would say, you know, always keep in regular contact with your donor. Keep them updated on how things are going. Be honest about, you know, any further anticipated challenges that are arising as well. So, you know, in summary, you know, with any crisis, I think it's about regular, honest, and transparent communication with your donor is really key. Back to you, Onward.
All right, thank you very much. If we were to come up with quotes from this session, I picked one where you say, "If you don't ask, you don't get," which is a very important conversation in terms of, you know, engagement that has to happen, as well as you talk about documentation. So I'll go back to Ugo. I'll go back to Ugo, and my question to you is the two speakers that I paid here talked about risk. They talk about you know, strategies and a lot of important things to take note of. And I want to say to you, to ask you, Ugo, and say, for the activities that we decide to continue, that we must continue, how do we adjust the activities, you know, to suit the COVID-19 environment? And just borrowing from what Stacey said about in terms of safety and in terms of, you know, risk mitigation and reduction, and also additionally in terms, you know, of complying with the World Health Organization regulations. You know, also different countries have their kind of you know, ways of controlling movement in different communities, even at community levels. Some communities have bylaws. So my question again is, for the activities that we must continue, how do we adjust them during COVID-19?
Thank you very much, Onward. I think my colleagues, Martha, Stacey, and Rebecca have already started talking about this and setting the scene for this. But I would use my organization as an example, JPIGO, and what we did during this period and what we are still doing. And I just want to say that there are two things or three things you have to think about. You just mentioned it. What are the country policies at this point in time? So, you know, we have a task force in Nigeria. We have a task force, the government task force, which came up with all sorts of restricted travels between different states. And we have projects in different states, where we have 36 states in Nigeria plus the Federal Capital Territory. Also, different states came up with curfews, you know, when you shouldn't be outside. And then also, of course, the stay-at-home policy and so on and so forth. So as you're planning, you have to bear all this in mind as well. But I think the most important is the staff. You have to kind of begin to think first of your staff. As your staff begin to venture out there and do some activities out there, how do you keep them safe? How do you mitigate the risk? So what we did in all our offices across the country was that we first of all ensured that all staff members had the messages around prevention against COVID. And not just against COVID, but in general, infection prevention control. And we ensured that they all had access to training, even if it is basic, on IPC, infection prevention control, through Zoom and other online platforms. We ensured that everybody had face masks, gloves, hand sanitizers, and that we had hand washing stations in different offices where we worked. And of course, the temperature checks. But also, we ensure that we give people option of actually working from home as well. So not everybody is coming into the office every day. It's a risk, especially when you don't have a car, you don't have access to a car, and you have to come with public transport, you know, to offices. So we make sure that people knew that they can work from home and they can call the HR or the COVID lead at any time to ask any questions, and so on and so forth. We also provided a guidance on what to do when you actually suspect that you might have COVID, or when you actually are living with somebody that might have COVID. So what are the steps that you can take? Who can you contact within the organization? Then in terms of the activities, you have to also think about what can you do within this period? How can you adjust your activities? And it depends on the program, you know, because we have all different programs, different projects. For JPIGO, we have this operational guidelines in the context of an outbreak. And COVID-19 happens to be one of them. And I will simply say there were 4 approaches we actually encouraged staff to work with. And the first approach was to think about self-care solutions. What are the self-care solutions? What are the advice that you can actually give people over the phone to help themselves? So things around where people can actually access over-the-counter medicines and oral contraceptive pills, emergency contraceptives. These are just examples, or even HIV self-testing kits. The second approach we used was, what are the telehealth solutions that we could use for different projects? And this was very, very important. And I'm talking about basic tech solutions, because you also have to think about the literacy of your target audience as well. So things like using SMS, on the phone, calling people, telephone counseling, if you are able to, setting up helplines, supporting the state to also set up helplines, developing mentoring tools. I think it's Marta that actually talked about that. Mentoring tools, telementoring tools, and then of course virtual training sessions, virtual meetings, because a lot of people couldn't actually come out. So there was a lot of this taking place. We also used the WhatsApp forum quite a lot because we had like quality improvement teams within the facilities for some of our services. And we kind of got them into WhatsApp groups, provided messages through there, and so on and so forth. The third approach is the community-based services, which we've also talked about here. So for instance, in our malaria project, we use community health workers, even before the COVID, and volunteers to distribute anti-malaria drugs. And then of course, TB drugs, and also some projects, HIV drugs. So thinking about how you can still do this, and also protecting those community health workers as well, and using other outlets in the communities that are essential to the community groups. And then of course, lastly but not the least, is also still providing facility-based services, but making it safe. And I think a lot of my colleagues have talked about how you can help the facilities ensure that people are social distancing or physically distancing when they come into the facilities, because they have to come, and finding ways to advise them in terms of screening and triaging patients, because you never know who walks through the door. So, and then also protecting themselves as well, and having all the hand washing stations. But for me, the lesson I learned through this period was, whatever you put in place or whatever you're doing, your client or target audience needs to know what exists and how they can actually access it. And it was important that we found a way to reach out to people that we already know, and use other means to reach out to people to say, this is what we are doing here for this particular project. This is how you can actually access it. So I will stop here for the time being. Thank you, Onward.
All right, thank you. Thank you very much, Ugo, for that input. And maybe just to go back to Marta and Rebecca. What has your organization done to adjust SRHR programming during COVID-19? Some of the issues you were already mentioning in the previous questions, but maybe more specifically, what have your organizations done in terms of adjusting, especially SRHR-related programming during COVID-19?
Thank you, Onward. And taking on what Ugo just said, the first thing was the priority. I mean, people, staff, and clients are the priority. So we also, same here, implemented. The first thing was to implement everything that was related to the biosecurity measures. Then we went to implement virtual counseling, free virtual counseling. 52% of the calls that we get through this call center are made by young people below the age of 24 years old. And it has become a counseling through which we can tell them what their rights are, what services are still open, where can they have access to them, because we have partnered with all the local and also private institutions that have remained open. So this free virtual counseling space has become very, very strong for us in order to give them information. We have also implemented telemedicine for some specific services. Not all of them have been allowed by the government to be provided through telemedicine, but the ones that have been allowed to, like family planning, access to contraceptive, abortion services in the first trimester, they are being provided through telemedicine and teleconsultation. We have also developed in the bigger cities of Colombia where we have operations, home care. So we have a specific team of doctors and nurses that have been trained in order to provide some services at home. We were asked by the government if we could help, since we have a very big coverage of the country. We were asked if we could partner with them in order to provide COVID tests. So in four of the main cities, we have to expand our services beyond sexual and reproductive services in order to be able to provide access to a COVID test. As I told you before, we open up a small line regarding mental health. This is a platform, a virtual platform. It is called, well, in Spanish, Porque quiero estar bien, in English, because I want to feel good. And it goes beyond, I mean, everybody can call, it's for free. And it's not only related to, you can denounce sexual violence, at home violence, but also the people that is behind responding the calls can help you through psychological consultations, try to deal with the different problems that the COVID has meant, especially for young people. We carry out a very strong partnership with local radio stations, because we find out, they're very easy and flexible, and they're always looking for information to share with their communities. So we have so far around 100 partnerships with these local radio stations, and through them, they're constantly providing the communities information about rights, sexual and reproductive rights, again, where to have access to them, how can you have access, what platforms are for free where young people can get their help that they need. We have to adapt. We carry out some training models for young people, again, with basic information on how to deal under confinement with situations regarding their sexuality, but also regarding violence. And again, since not everything has to be, so medical or so, how could you put it, like rigid, we have developed throughout the months different contexts with our young networks. And the contests have had to do with developing games, poetry, history, and this has given them then the chance to get together and to speak about things that are different from the COVID and the problems that they're facing at home. This contests have become like a different space for them to enjoy and speak about and have their minds being taken off from what we've seen every day at the news and everywhere around the globe. And another thing that we have been doing very, constantly, again, and trying to think about how to deliver the information that young people needs, and at the same time, how to give them different spaces to enjoy. So a lot of Facebook Lives with different subjects, a lot of very strong social media, constant communication with them. And also we create an external network with partners. I think it is very important, something that has become very important through this pandemic and crisis is the availability of all the local partnerships that already exist. So while we specifically deal with everything that has to do with sexual and reproductive rights, we have been able to partner with other organizations whose help is also needed. Like they are very strong regarding sexual violence or at-home violence. So through these partnerships, we are able to respond in a more comprehensive way. And I think that at the end, what this has created is a sense, that, this is not the end of the world, that we will be able to survive and that we have the tools that will help us carry on through this crisis and regain some sense of normality. So for us, these partnerships have been amazing, and not only with the donors, as you have mentioned before, but also even some public institutions that are really worried about young people. They have, they're always willing. Can you share information? Can you share the material that you have developed? What are the tools? What are the guidelines? And they publish them in their networks and in their webpage. And I think that has truly helped a lot of people to have access to the information and the helplines, and in that sense, lower a little bit some of the anxieties and being able finally to access services and have the right consultations and contraceptives that they need.
Thank you so much, Martha, and also Hugo, for sharing your examples from your organizations on the adaptations. I think quite a few of them have been also done in Save the Children, but I thought I might just mention a few which we haven't maybe touched on yet. So in Save the Children, we did quite a bit of task shifting. So we identified, for example, focal points. So focal points for COVID. So somebody in your organization who has extra time to look at the updated relevant guidance, who can maybe compile it and put it into like a training package, or who can communicate it to the staff. And so that not all staff have to spend the same amount of time on staying up to date. And in COVID in particular, I mean, findings were changing by the day, wasn't it? So it was really important to have this focal person who could help other staff members staying up to date. We had staff health focal persons who were trained in being like the first contact for a staff member who was unwell, and giving advice on the next steps on quarantine and self-care and referral and all of that. But then also in our programs, we had shifted some of our roles on community level. For example, a lot of our community health workers in Eastern and Southern Africa got additional training in COVID management, COVID surveillance, how to teach communities on basics around COVID and how to keep their community safe. And they were our COVID frontline workers with kind of that adjusted or advanced kind of role or responsibilities for the response. We also had some more unique examples. For example, in India, our programs reported that they identified medical students who then were trained in supporting the community outreach to some of our target populations. We also heard that from other programs where clinical and medical staff were kind of shifted as needed in a program. I think another key point was kind of helping our field programs to have the right information around infection prevention and control, and also PPE. And I know it has been mentioned a few times, but there were a lot of questions around what is the up-to-date guidance and how can we actually get PPE, and how can we, what do we need to plan how much the consumption will be, and how can we plan an additional buffer stock for our services. And so there was extra capacity building, extra logistical support to ensure that all of our frontline and field programs had access to that type of information. And then not only how to get PPE, but also very important kind of waste disposal and the environmental impact, what to do with PPE and how to conserve PPE in places where it's very difficult to get adequate and kind of sufficient amounts. And so we really try to ensure to make that information available. And then maybe one more point was around how do we ensure that our risk communication and our key messages were really reaching the right people, and how could our programs ensure that key stakeholders, for example, churches or youth leaders or clinical workers could be engaged in that process of identifying the best key messages for a community. And I have another good example from programs, safety children programs in Laos, for example. They were identifying that pharmacists played a key role in speaking with communities about healthy behaviors and also how to protect themselves. But somehow they were really disconnected to the formal system and struggled to get the right information. So the program was changed into ensuring that those pharmacists received the right material and covered key messaging, and the programs produced some IEC brochures and info material for pharmacists in particular to address that need. Yeah, I think I will stop here and hand it back to you, Onward.
Thank you very much, Rebecca. I think I'll put you on the spot once again. There is a question from Nancy in the chat box. She says, what do you suggest as a protective regulations before the second wave of COVID-19? Would you want to take that?
Yeah, that's a really good question. I think this, the second wave, there are a lot of debates around, when do we actually declare a second wave, and have we actually passed through the first wave? Have we recognized kind of the peaks and when the curve flattened and all of that? I think to step away from those epidemiological questions, I would say for us as field programs, it's really important that we build our kind of programming on what we know now. And things might still change, and we will still get more information around transmission and vulnerability and mortality data in future. But we are not starting as it was in March, because we have like 6, 7, 8 months of a lot of key information and guidance and WHO kind of guidance and protocols and tools available. And I think we have to work with that and build our programs and also our program planning on what we know now. I think that's really important. And then often the key measures, first of all, we know that there's not only one measures, we have to do as many as possible. Sorry, what I wanted to say, like often we know that the very basic measures around physical distancing, wearing masks, hand washing are the ones they will need reinforcement all the time, because they're often forgotten, even so we know how important they are. So I think the key is we should continue our programs building on the information we have, but also really reinforcing those messages, because vaccine alone or risk management alone or infection prevention alone will not be enough. We need all of those tools in our toolbox, and we need to make sure that we then apply them to protect ourselves, to protect our communities.
All right, thank you so much, Rebecca. There's another question that I want to pose to Ugo. It came from Ishimwe Alliance. Ishimwe Alliance. The question is, considering that in our cultural societies, we don't normally talk openly about sexual and reproductive health and rights, how do we assist young people in need of those services? So young people are in lockdown, they are locked down in their houses with their parents, you know, there's no free movement. How do we assist those young people?
Okay, you know, honestly, changing behaviors, social norms, all the cultural beliefs that we have is a long-term thing. It's quite difficult, and it's an ongoing issue. So the way we actually do it now, because in Nigeria, I must say that we have different parts of the country who have different cultures and different social norms, and you can talk about certain things and can talk about and you cannot talk about certain things in some parts of the country. But the way we actually approach that is to begin to look at, map out, where do this young, under normal circumstances, what do these young people listen to? Is it radio? Is there some other things that they can listen to? Do they listen to their peers within that community? And then just find out exactly how you can reach them. So most of these education might not be from, you know, what would I say, your parents or your teachers, but your peers within that community. So you have to find a way, the projects involved in this have to find a way of actually informing those, ensuring that the peers actually, people of that same age group that do this work actually have enough information and have enough reach to the same young people that they're in the same age group to actually pass the information on to them. It is very difficult when you have a lockdown and everybody is at home, you know, to be passing this information. But, you know, the lockdown was not forever. So it's about preparing after the lockdown, how do you reach them? In this country, we use various ways. You know, we have things like, you know, even people going to the motor parks, people also, we have a group of people we call our Majiris, young people that you know, don't have access to this information, and we have peers that actually go to them and are able to pass this information. But it's not a short-term effect. It just has to be a long-term, ongoing activity that you have to kind of keep re-emphasizing this project. And I'm sure people have used various ways, you know, pictorial, information materials, depending on what your audience is able to accept. I'm sure my colleagues will probably also have examples of what they've done in their country. But it's a long-term thing to actually begin to look at culture and change cultural behaviors.
Thank you so much for that. That is very important. I think from my experience also, I think, you know, with young people, that there are various spaces where they are interested in being in, and which are safe spaces for them. So for example, with my organization, we have created WhatsApp groups with young people where we interact so much about many things, and, you know, sexual and reproductive health becomes, you know, one of the subjects where to get services. And we have actually also trained young people who are community cadres, young people who have a certain kind of influence to other young people in their communities. Maybe there are young people who are in arts, dancers, those who are in business, to really, you know, talk about sexual and reproductive health services. And we have also created a referral system where these young people who are champions, they have referral slips that connect with the services. So if a young person wants information or if they want a service, they're going to get a referral slip from the champion. And then we have a roving team, which then supports a young person who wants to access services with a letter, because you know, in Zimbabwe, you need a letter to be moving around. And if you don't have a letter, the police is going to arrest you for breaking down lockdown rules. So we have those letters ready. We send them on WhatsApp. We also send some of them for young people who do not have access to WhatsApp or internet. We also send text saying, you know, there's a meeting that we have with young people, and the limit to the gathering is 50, and we want to give them information about COVID-19 so that they can give to their families and peers. But you know, the young person will be actually going to access a service, and we will be sending this text in terms of bulk SMSs, in terms of also demystifying the myths and misconceptions around COVID-19, so that even when young people, you know, show their parents something and say, I'm going out and I'm going to attend this, they feel like it's valuable for even the family and the community for them to go out and access that service, that information. But also we have an opportunity to talk more about services and help young people to access those services. So there's a question from Oro from the chat box, and it's directed to Stacy. Oro says, so in listening to all of you, the adaptation tips you offer already require a lot of resources. When you offer, for example, virtual sessions, phone calls, donations of protection kits, our organization of young people with low means would not be able to offer this. Even if we make an effort, it will be insufficient. We intervene to above or inform, raise awareness about barrier measures to be observed. We are also working to dispel the myths surrounding COVID-19, but there is a problem of protecting us activists and our target. Stacy, how would you respond to Oro?
I mean, thank you, Oro. It's a really valid and really important question. And I think ultimately what we have to acknowledge and accept is that resources are needed. That there's no way around having zero resources. And that's because we have to keep people safe. If you've got staff in the communities doing community engagement, different activities, there are, you know, minimum standards and minimum activities that we need to ensure that they're safe, and that requires resources. So I think it's key to look at ways in which you can access resources and fundraise as much as you can. And I know, I think Katie's going to talk about funding at the end, so maybe you can ask her for some resources. You know, and I think there's different, you know, cost efficiency ways of doing things. Not everything. I think, you know, within COVID, we've started to lean into using technology a lot more, which can come with big costs, but it can also come quite cheaply too. You know, WhatsApp we've used a lot through COVID and through our programmings. And actually WhatsApp doesn't come at a cost once people, you know, have phones and things. So I think that there's ways in which we can actually look at how we can do things more efficiently cost-wise, but ultimately there is a need for resources, because you need to ensure that your staff are safe when they're delivering you know, these services and this work.
All right, thank you so much. Maybe to go back to Ugo just a minute. So you talked about those that are receiving services through your program, and want to really focus particularly on adolescents and young people. Those that are hard to reach, because I think when we talk about social media, when we talk about virtual meetings, we are really already talking about, you know, the privilege. We have adolescent girls and young people who might not even have access to cell phones, access to internet, or access to gadgets and information that is portrayed on social media. How have you continued to engage them? Just in a minute.
Okay, so I'll just use one of our projects to give an example, one of our HIV projects, where we actually target a lot of adolescents and young people that have been very hard to reach communities. And you're correct, might not even have a phone in terms of reaching facilities and so on and so forth. So what we do is in those interior villages and communities, some you have to actually walk quite a bit, or even take a bike inside that village, or even cross a river with a canoe to get to them. We actually select and engage community workers and volunteers within those villages, and they know where their peers are, especially young people and adolescents. So we've actually worked with these people, giving them a lot of training, also provided them with PPEs like face masks and gloves and hand sanitizers to actually reach these interior communities, to reach our target audience, to either do the test or educate them, not just for COVID, but also for all the other issues that they might be having. Because, when you get to that sort of audience, you want to use one-stop shop and actually try and get through all the information you want to get. It's not just COVID, it's also about their sexual health, it's also about their HIV status and how we can actually help them prevent it. So that's the people that we actually use to engage these people. And sometimes they might turn positive, and it's how you now get to them to link to facilities. And what we've done is, if they are not able to get to the facilities, we have ensured that we actually provide them with what we call multi-month dispensing, so that they actually have these drugs for a number of months and don't have to visit the facilities and so on and so forth. So again, is using knowing who knows the environment and using that person within that environment to reach those hard to reach. And that's how we've done it in the HIV project.
All right, thank you. Thank you so much. There's a question from Empower Youth, and it's directed to Martha. Empower Youth says, I'm really wanting to get involved with youth leading and empower youth in my area by helping them understand sexual and reproductive health and rights. What specific services will SRHRI have for us youth? And how can I educate my friends about it? Let me repeat once again. I'm really wanting to get involved with youth leading and empower youth. With youth leading and empower youth in my area by helping them to understand sexual and reproductive health. What specific services will SRHRI have for us youth, and how can I educate myself about it? I wish I could rephrase that. I hope you pick what.
Yes. Yeah, I hope I share the information that I think I understand she needs to know. First of all, I would say that there are a lot of resources on the web. For example, we use one which is called Amaze, and this is a series of videos, animated videos that touch on most of the subjects or the topics that affect young people, and they're for free on the internet. But again, I know that in many cases, and really my heart goes out to you, the question that Oroguro posed, and I understand. I mean, it's a very different thing to speak from a point of view or from a condition where you do have the resources in order to develop different means of guaranteeing your programming, even in the midst of a pandemic, and another totally different one to try to do something when your resources are very little. So I understand that sometimes even having access to the internet or to connectivity is not easy. But one of my answers would be there are free resources there, and I'm sure for what I have seen that in many countries a lot of guidelines and protocols have been developed regarding sexual reproductive services and rights, especially when it comes to young people. So I will try to reach them. Usually by now, I mean, not everywhere, but most of the governments already have some policies regarding sexual and reproductive rights. So I will try to do a little research and trying to find those resources that some of them are for free in the internet and are very educational, and they even have sometimes guidelines that tell you this is how to the correct way to share the information. These are the myths and the truth about sexual and reproductive rights, because there is a lot of that also, a lot of information that is not correct. But something I would gather from several things that have been said in this meeting about finding tools that are not expensive, like the WhatsApp. And if you don't have connectivity in your home, you can go, usually there's, I don't know, like here in many of the very small places in Colombia, very rural areas, in the parks, the government has put antennas. And I know that not everybody can go out of their houses and gather in the park to speak, but maybe, you know, as they keep opening a little bit the restrictive measures, you can find places where you can connect and have access to this type of information. And also, I think this is very important, because I know that you as young people, and I have young sons, and they keep saying, you know, we really want to talk about things not only that have to do with the COVID. We do want to find out more about sexual and reproductive rights and all of that. So, and I know, again, this meant resources, but it has been so helpful. We developed a series of Facebook Lives, and we invited different people that we know that speaks well and knows a lot about different things. And just to give you an example of the meetings that we carry on, new masculinities, not all men are cut with the same scissors. HIV, more than 3 letters. For a world where colors are lived without fear and with freedom. This was carried out by a transgender woman. Female orgasms, right to pleasure, women claiming the right to feel. That one got quite a big audience. So yes, I agree that even though we are living on this umbrella of pandemic, COVID, fear, uncertainty, and confusion, when it comes to sexual and reproductive rights, it's at the basics of every one of us, you know, and especially young people who has been left out of schools, left out of, you know, the way they were carrying on their lives with their friends, and everything has changed so much for young people that I need that being able to develop even the simple strategy that can get you together to speak about it, being WhatsApp, listening to a local radio station, trying to partner with other organizations locally that can give you the space or even help you with the resources. In our case, I give you another example. We partner with seamstress, people that knows how to sew, and they were able to teach through a little video to teach young people and some of our users how to make their own mask with some material that they have at home. So I know this might sound very, very simple, but there are very practical measures that you can start doing right away. And I know it is frustrating because everything has come to like a standstill. But I tell you that you have to look for creative, sometimes the strangest ideas, they become the stronger ones. Sometimes, you know, give it a try. Don't put them down like, no, this is too crazy, this is not going to work. Like, for example, another thing that we did, we went to start looking for local community leaders very fast, because we were not, I mean, all of us have stay home, the clinics open, but in very restricted measures, and we needed to keep contact with the community. So we started reaching out through our Young's network to those local leaders and say, do you want to work with us? We know that this information is needed. can we, if we give you a test, if we print a document, would you be able to share it with other people that you know locally in your community? So I know challenging times, but challenging times means, you know, try to go out of the box and don't get overwhelmed by the bad conditions, and try to reach to that creativity that is usually there, not too openly, but now it is really required.
All right, thank you so much for this comprehensive response, and you know, I can feel and see the passion that you already have for young people. There's a question from Simon, which says, to stay strong and stay strong, youth-led organizations need to identify available opportunities. So it's not a question as such, right? Available opportunities of grants to support their work. I would like to know if there is specific funds available to support youth-led organization activities, and how can youth-led organizations identify donors. All right, so I think, thank you, Simon, for that. There are a lot of resources that are there online, and you know, there are also platforms that share. I think, for example, in my country, there is what is called Funds for NGOs. It's an online platform which collects all calls for proposals that you have to do with Zimbabwe, and they put them on their websites. I don't know if in different countries there are such kind of platforms. And I've also seen some institutions like FP2020, institutions like Women Deliver, IAWG, PNMCH. They share a lot of resources, and there's a lot of opportunities for youth and youth-led organizations. So you might actually probably need to subscribe to their newsletters on their websites as well, so that you can get updates on opportunities and even engagements that are there for young people. And you know, for us in my organization, we keep on even doing Google search every time to just check if there are any, you know, funds from anyone that are focused on sexual and reproductive health, young people, youth engagement, and if they actually focus on in our country. But also just try to do what we can do with the little resources that we have. Like we also do information dissemination through arts. We do short video skits, and we send it out on social media, and we get a lot of engagement on social media with young people. And sometimes when you continue to do what you can with the resources that are available to you, sometimes actually donors can actually, you know, see the work that you are doing, and also reach out to you. But definitely, if you go on Facebook, or there's also a website that is called Opportunity Desk for You. Opportunity Desk for You. They post a lot of worldwide opportunities for young people, educational, funding, training, scholarships. They share a lot of those opportunities as well. But there's another opportunity that is already here with us in this meeting, and that is an opportunity from IAWG. And I'll give back to Katie to tell us more about this IAWG funding opportunities only for youth-led organizations and youth-led initiatives. Katie.
Thank you so much, Onward. I hope everyone can see my screen. So yes, as Onward said, we have an opportunity during this webinar series for youth-led and community-based organizations to apply for small one-time grants to support things like Oru was mentioning, and several other participants also mentioned things like if you want to hold a Zoom meeting, having the funds for a Zoom license, or perhaps all of your staff was not ready to work remote, so you need additional laptops. Maybe you need more internet cards as things have moved virtual. All of those things this grant will support. We are accepting applications on a rolling basis until the 23rd of September. And I just want to mention that we are prioritizing youth-led and community-based organizations that are doing sexual and reproductive health activities. And then on top of that, we are looking at organizations that are on the smaller side. So if you are a large community-based organization, you may not receive one of those grants. We are really trying to help the organizations that need it most right now. Everybody needs this funding, obviously, but we are trying to make sure that the smaller organizations get a big share of this funding. So I'm going to now take you to the IAWG website, where you can also find all of the information for this webinar series. You'll see that we have session 1 recording, as well as the key takeaways from the session. And if you click on this tab, you'll see that it is available in English and in French, as well as pasted here. And then on that website, which I am sending to the chat box now, there is the information that everybody wants, how to apply for this funding. And then we do have the application in French as well. And Onward's gonna wrap us up in a second, but just to say that the information for registering for the 3rd session is also available on the website. I will pass it back to you, Onward. If you do have any questions about the funding opportunity, you can direct them to me, Katie Meyer, and I will type my email address into the chat box. Thanks so much.
All right, thank you so much, Katie. And just to say thank you so much for such an opportunity, especially, you know, with the kind of focus that it has to make sure that youth organizations and community-based organizations continue to actually do their work. And just encouragement to all young people in the house, all youth-led organizations and community-based organizations. Please, 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 please apply for this opportunity. All right, and let's submit before the deadline. So as we close, I just want to thank everybody. I just want to thank the panelists that have been with us and that have taken their time, you know, to share important resources for all of us, and important information about what we are all doing. And for everybody that joined these conversations all over, we thank you so much, and we hope that you know, this series is helping us a lot in terms of, you know, standing strong and, you know, continuing doing our work. So thank you so much, Stacy. Thank you so much, Ugo. Thank you so much, Martha and Rebecca, and the IAWG and the FP2020 team that is working to make sure that, you know, this engagement goes on. I also want to let everybody that has joined that, you know, the session was being recorded. So if you want to look at it again, or if you want to share with your colleagues in your organizations and in your network, it will be shared through the details that you have used to register. And also it will be the other opportunities and the other resources that were the colleagues were sharing will also be shared with everyone. in follow-up communications. So then there's another session that is coming in, and as Katie said, it's there on the website. So it's around getting ahead. So this is a session that includes how to fundraise and how to communicate with donors, and the thinking through actions for the next emergence. Like there were questions that were already coming about maybe another second wave, or maybe another epidemic, or even still in this level and scourge of COVID-19 that we are having. So from me and the team that has been, preparing this session, I want to thank you all, and there can never be enough time. But I hope that you were taking notes and you took contact of everyone that was speaking, so that you can actually, continue engagements. As you have seen, they are very youth-friendly, youth-loving people that were here. And Stacy, I love your background. Thank you so much, everybody. And this is the end of the session.
Thank you. Bye-bye.
Goodbye.
Nice seeing you.
Thanks a lot, everybody. Thanks, Onward.
Thank you. Take care.